Hello, everybody. Welcome back to Psychedelics Today. This is a Solidarity Friday episode with Kyle and Joe. Hi, Kyle. How you doing today?
Good. A little groggy today, but overall pretty good. How about you?
Excellent. I'm doing pretty good over here. Still beautiful in Colorado, so I'm happy about that. There was actually a forest fire recently down the street, but it got extinguished quickly. Thank God.
It's fire season. I'm guessing summer's usually fire season up there.
Yeah, anytime where there's not snow. But yeah, we've been getting actually a decent amount of rain, so keeping it at bay. Yeah, so let's see. Yeah, before we get into the news and a discussion around psychedelics and somatic psychology and a few other topics, I just wanted to bring up that we have a class coming up. Many of you have probably already heard about it. It's called Navigating Psychedelics for Clinicians and Therapists. The class is an 8-week live supported class. There's also a self-paced option where you have access to a ton of material that we work through together as a group and come together once a week for 8 weeks to work through the material. It's been a really rewarding experience so far. We're now approved for continuing ed credits for a number of different professions. You can read about that on our sales page for it. So check that out, please, if you're interested. Psychedelics Today. Well, sorry, psychedeliceducationcenter.com.
You can get there through Psychedelics.
Too many URLs out here. Yeah, psychedelicstoday.com will get you there as well. Totally. Just under online courses. And class starts in this next round on September 17. Classes are selling out pretty quickly. And I think worth pointing out here, this is probably the least expensive you'll see this course ever again. So if you want to delay, that's totally fine, but just know that it might be a little more money downstream. We have 2 different groups. One starts at 2 o'clock Eastern and the other one starts at 4 o'clock Pacific, 7 p.m. Eastern. And both start on September 17. So again, psychedeliceducationcenter.com to learn more. And we're happy to answer some questions. And I'm probably going to do some webinars to help answer some questions about it too, because I know a lot of people are curious, but it's kind of hard to describe what happens in an 8-week course in a couple minutes of ads. So
that is true.
Yeah, I think that's good. Again, as always, it's awesome if you leave us a review on Facebook or iTunes or the podcast app. So please feel free to do that. It would really help us a ton. It means a lot to us. Putting out this free content every week is awesome for us, but it's also awesome to see some positive feedback out there. So thank you all for tuning in, and let's dig in, Kyle. So we've got a new article about sublingual drugs. What do we have here?
Yeah, I just saw this one on Forbes. So a Canadian company, Cybin Corp, which is a Canadian mushroom life science company, they're trying to redefine the way psilocybin can be administered. So they're looking into collaboration with a drug delivery company, IntelGenx, to create an orally dissolvable film that delivers pharmaceutical-grade psilocybin in patients.
Nice.
So in this article, they said kind of like kin slips did for cannabis. So just trying to give an oral administration to older adults for an easy to administer, dose controllable, fast acting, and convenient way to receive their medicine. So it's going to be interesting to watch drug administration technology develop as the psychedelic renaissance continues and more drug companies get involved. And I know you made a little pass on one of in the past, transdermal, maybe at some point. And I know one of our past guests, Fawn Russo, chatted about some of his technology with cannabis.
There's so much new tech coming out with all these things. So we don't even know.
Yep.
It's going to be really interesting. I can't wait.
Yeah, I mean, even just think about cannabis, for example. Typically you would maybe just eat it in some sort of edible or just smoke it. And now you think about you obviously still do that, but just think about the technology, vaporization. You got all these extracts, these rigs, and it's evolved pretty quickly.
I don't know if I ever told you this. So this, but my girlfriend opened one of the first recreational shops in the state the day it became legal. And she was selling these transdermal patches. There's all sorts of different technology for transdermal patches. This is just kind of the rudimentary kind of first stage thing. And this guy would come and buy these patches by, I think the company was Mary's Medicinals, maybe. I used it a bunch for surgery too, but it was a transdermal patch with like different ratios of CBD to THC and whatnot. I'm sure there's a lot more options now, but it was really helpful. And some of the clients she would sell to would have like ferocious tremors, so bad that they couldn't even hold their children or grandkids or whatever. Mm-hmm. And they would like cut it up into quarters and they would be good for a day.
Oh, wow.
No tremors whatsoever. And it's just extraordinary. So like one product could just really intervene on some serious situations. So yeah, there's so much left to discover here and so much left to help people with. And, you know, who's to say in 30 years, we won't have like transdermal 2CB for festivals, you know?
Right.
You want to just have your patch on when you go into Bonnaroo or Coachella or whatever. Cool. Like you don't need to carry a bunch of pills in your pocket or whatever. You know, there's a lot of angles here.
So for somebody that I guess like may not understand why somebody would want to develop all these different routes of administration, like what's your take on it? Like, you know, just thinking about like an orally.
There's people that can't swallow.
Right. Yep.
Like, let's just start there. Like there's people that can't swallow with throat cancer. Big deal. Like what if you could just do it transdermally? Mm-hmm. And like, I'm thinking of like the Listerine strips. Yeah. It seems like it'll be something like that, like a film. And it'll dissolve pretty quickly and it'll go into the bloodstream pretty quickly, I think. So like the alternative is injection, I think, or like nasal administration. We don't, you know, that's not really pleasant. Like why not just have this little tab that you can dissolve under your tongue or transdermal patch that you can put on your skin? Like people are in excruciating pain. People are suffering really bad. So like having all types of routes of administration available, I think is a really good move.
Totally.
Yeah. And not to mention novel drugs. Like this is why I'm kind of okay with people looking at how do we take the trip out of Ibogaine and still provide a helpful drug. Mm-hmm. It makes the drug a lot easier to use. It can help a lot more people at scale because there's a lot of fucking people out there that need help.
Yeah.
Hopefully it's not offensive to too many people. But if it is offensive to you, perhaps examine why that's offensive to you.
Yeah, awesome. I think that's probably it for this article, unless we wanted to chat anything else.
I'd like to know more about this company. I've seen their name a bunch. So, you know, eventually we'll dig in on that. But yeah, let's jump to the next one. Which one would you like to go to?
I'm actually just reading this really quick. Pill-phobia is a very real concern for many patients, and particularly for seniors. Oh man, yeah, I've definitely had
because they take so many pills.
Yeah, or even just I had a problem swallowing pills when I was younger. I was always afraid I was going to choke on them because I have choked on them in the past.
Chewable aspirin.
Yeah, exactly.
I've seen all those things. Yeah. Chewable gummies. Yeah, it's pretty intense. Like these days, I'm able to swallow like probably 15 pills at once. It's pretty absurd. I'm not taking 15 pharmaceutical. It's all supplements. So yeah, it's interesting.
Cool. Sorry, what were we going to say? That phrase.
So let's jump into a different article here. Like this one published on Sage Journals. The title is "Psychedelic Treatment for Trauma-Related Psychological and Cognitive Impairment Among U.S. Special Operations Forces Veterans." The researchers here are Alan Davis, Lynette Averill, Nathan Cepeda, who's been on the show. There might be others. Joseph Barsuglio is involved. Cool. So that's interesting. And then Timothy Amoroso. And this is a really, really cool study. 65 people. It's all survey based, all special forces veterans. And they went to a particular clinical program in Mexico from 2017 to 2019. And you said they started with Ibogaine and they did 5-MeO DMT next?
That's what it sounded like under their methods section. I think they said on day 1 was preparation, day 2 was the Ibogaine, and then day 3 was the 5-MeO.
Yeah, interesting. So this study had some pretty decent results. So it's only 65 people. There is no blinding, but they concluded that psychedelic assisted therapy under research psychedelics may hold unique promise for this population. So yeah, they had a lot of great results, like lower anxiety and depression scores. They rated the experience as one of the top 5 personally meaningful in their life, 84% of them. spiritually significant, 88%, and psychologically insightful, 86%. So, like improving cognitive impairment, PTSD symptoms, depression, anxiety generally, that's enough usually, but you got all these other benefits as well. So I think there's something there. Like, how do we make this scale? How do we make this available to more veterans so they can, come back and integrate a little bit better to society? Because it's hard. Culture is not necessarily set up for them. So yeah, like this could really be helpful.
Yeah. And let me backtrack a little bit. I kind of, I guess, read that wrong when I first read it. Day one was their preparation, screening. If they passed everything, then they did the Ibogaine on that day, and they took it in a group setting with 4 or 5 participants. All participants laid on a bed and received that as well. And then day 2 was integration, journaling, writing, and they spent time talking to everybody speaking of their experience. And then day 3 was their 5-MeO experience. And they did that one at a time, which sounds like probably might have been also in some sort of group, but maybe each person went individually.
Cool.
Doesn't say that though.
And it doesn't say if it was at Crossroads. There's a suspicion here that this is data from the Crossroads clinic, but it's not really too specific, I don't think. I just searched Crossroads in the article and I didn't. And I suspect that because Dr. Joseph Bersuglio was involved and he used to run that facility. And that was a pretty top tier facility for a long time. It was like the most clinical environment you could imagine. Like you're kind of hooked to machines the whole time and supervised by a medical pro the whole time. So great, but it's totally not clear in the article if it was there or not, or various places. So yeah, optimistic about that. I like that they're niching down into very specific populations. Like you could do U.S. Army vets totally, or you could do special forces. What I'm noticing is that we talk about veterans a lot, and there's a lot of veterans who are not combat veterans. They never really saw a firefight or explosions, and they're not really put into the same category, right? Or they're largely put in the same category. Like you could have been a mechanic or something, and Baghdad never heard a gunshot, and then you can also get really hurt and sick, like PTSD wise, from just being in the military. Totally, no doubt. But should we or do we want to differentiate, non-combat veterans and combat veterans? So just a question. I'm not really saying we should or not. I've talked to some combat veterans, and they're a little upset that other veterans are kind of like non-combat veterans are getting this attention. So just, food for thought. I'm not trying to pass particular judgment. I just wanted to pass that along. And I think there could be some good research done if we kind of like had these 2 different groups.
Yeah, definitely.
Yeah. That's how research works, right? Anything else you want to add on this one, Kyle?
No, I just thought it was interesting to see this article come out exploring Ibogaine and 5-MeO. And I don't think I read anything about addiction, because usually when we think about Ibogaine treatment, it's usually in conjunction with some sort of addiction treatment. So yeah, just really interesting. And it's exciting to see that study get released. So, hopefully it helps to influence further research and treatment. As they said in this article, vets and whatnot, maybe the population that's not really reaching out for mental health treatment. So would be really great to have some tools that could really help them in the future.
Totally. All right. So on to the next one here. Title of this study is the pharmacokinetics, efficacy, and safety of a novel selective dose cannabis inhaler in patients with chronic pain, a randomized, double-blinded, placebo-controlled trial. I'll try to read the first 2 names and everybody else can dig in. This is published on May 23, 2020. Authors Shlomo Almog, Judith Aaron Peretz, and Simon Wolfson. Yeah, I'll kind of stop there, but it's a really interesting Israeli study. And they were trying to say, like, okay, what if we administer 1 milligram orally, inhaled? What does that do to pain? And they had some pretty good results. So the statement here in the results line, the 1 milligram dose showed a significant pain decrease compared to the placebo. Adverse events were mostly mild and resolved spontaneously. there is no evidence of consistent impairments in cognitive performance. So it's kind of cool. They did a kind of multifactorial study, like how do we judge pain, cognition, and a few other things. And it's, you and I just chatted earlier, like microdosing cannabis is actually pretty cool. I used to eat edibles like really slowly throughout the day, and it was really helpful. I didn't get stoned. I could still work all day long on kind of like serious stuff, and it was great. And what was your experience with microdosed cannabis?
Right. Yeah. Maybe a little bit of a nuanced. I don't know if it's really considered microdose or just very, very low dose. I typically like to do it that way.
Mm-hmm.
What I notice, I guess, this depends on route of administration. With smoked, it's sometimes you can't really tell. You take like a small little hit, and it really depends. But with edibles, something I've noticed is just taking around like 2 milligrams or so, and just noticing my body a little bit more, like being a little bit more aware somatically, kind of helps me get out of my head. It almost feels like helps me focus a little bit more at times too. So I guess helps me get out of my head a little bit more into my body and allows me to like do things. And it's not, you don't get too high, or at least like that hasn't been my experience, but just a little change and just more awareness. And I think, I don't know, I really enjoy that medicine for that. Just be able to drop in my body, get out of my mind a little bit, and it helps me focus at times. And sometimes great sleep, take a tiny bit before bed or something, and just, get some nice sleep as well.
Yeah. So it's hard to this idea of a microdose is still a little subjective. We don't have like a serious consensus on what it means, really. I err towards the Fadiman definition of like subperceptual doses. You shouldn't really feel high. And yeah, I think there's a place for all these different dosages in culture and in humans. So I'm kind of in support of all of these options. And yeah, if someone's afraid of cannabis, why not give them relief by limiting it to 1 milligram?
Yeah.
Which Mike Hart says 2.5 is really orally. 2.5 milligrams is the kind of threshold for most people where they're going to start feeling it.
Mm-hmm.
Like 3 milligrams, lots of people should start feeling it, but not everybody. So 1 milligram inhaled is pretty safe, I think.
Mm-hmm.
And a pretty good, talk about a great way to get cannabis better into medicine, a specific inhalant situation. It's going to be kind of hard to do that with natural plant.
Right.
But maybe you could. A high CBD strain with just a little bit of cannabis or THC on it.
Right. Yeah, I think that's the hard thing with inhaling cannabis, plant material versus taking an edible that's probably just made out of, isolate usually?
Pure isolate typically.
And I do notice a difference between edibles that are made out of isolate versus especially edibles that are made from plant material.
I've been having a lot of homemade lately. It's kind of awesome.
especially when it's infused in some sort of butter. Those I actually don't enjoy that much. Sometimes, I have to get the dose down right, but sometimes those are just way too overwhelming. I sometimes like just the THC isolate with a little bit of the THC at very, very low dose, and works perfectly. It feels like it has a good come up, good come down. Sometimes with those infused butter edibles, they just last forever. I don't know. My body just maybe takes a while to metabolize, and I don't know, it just gets uncomfortable.
Yeah, it's interesting, right? There's so many different angles here for how to ingest these things and why to ingest them. And I think people should just experiment for what works well for them and err on the side of caution with dosing, because cannabis has been very scary for me at times. Other times, you can smoke it every day. It's fine. It's a really weird, wild ride. It's a really strange drug. I don't totally understand why. Perhaps because we don't totally have a handle on the endocannabinoid system yet.
Yeah,
the way we'd like to. But I don't know.
That's good harm reduction tips. I've definitely heard, I've had a friend tell me oh man, I hate edibles because I just had a terrible time and I was stoned forever. And, I think, if you're going to eat edibles and really, really start low, because you take too much. And I don't know, my experience there, again, thinking about back to David Krantz episode, talking about the way genes play a role in cannabis metabolism, especially with edibles, that might be a factor. Some people could eat like 50 milligrams and really not feel anything versus like, if I ate 50 milligrams, I don't really know what would happen. I don't think I've ever eaten that much, and don't know
I'm going to have a situation.
Yeah, I don't know if I do want to have that experience.
I've had that much or more before. It's like I was pale. I think there was some sort of like a sugar spike where I was like, couldn't really interact with people. It was almost like a diabetic shock.
I mean, I probably had that when I was younger, like just not really knowing how much I was actually eating. But, I think that is just wise words of caution. Like if somebody hands you something, what would it be like to start with maybe like a fraction of a dose? And for example, I did some house sitting for a friend one time, and he had a homemade, it was a little Lego block. So everybody knows how big a tiny little Lego block is. I guess they had like chocolate Lego molds or whatever. And he's like, oh, I left one in the refrigerator for you. And, typically thinking like, oh, this thing's small, I'll eat the whole thing. I was like, I'm going to cut off one of those, like just one slither. So I'll get 2 of those little dots. And there's like 4 of those connector dots on there, or I guess 8 of them, right? So 4 on each side. And so I just cut it into like a quarter. And I was walking, and I just thought, I'm so glad I ate a quarter of that thing versus the whole Lego block. So yeah, just if you're experimenting, start small. And maybe you'll notice that you'll find a different relationship with cannabis over time if you're not taking these huge doses and thinking about like, oh, my friend just gave me this and I'll eat the whole thing. Like, start really small and see how it affects you. And then you could work your way up.
Right.
Harm reduction tip 101. Know your dose. If you don't know your dose, start very, very small. Very, very low.
It might be an okay time, but it could be that you're going to have a really bad time. And you just don't want to have that. This whole like Rick Simpson oil thing, treating cancer with Rick Simpson oil, it's wild to me because these people who haven't really had cannabis in their life are taking enormous doses of THC.
Yeah, like over 100 milligrams plus.
It's fucking wild. I know this woman who's done it, had some success with her cancer with Rick Simpson oil, and it is just insane to me that she was taking these kind of doses. But if it works, it works.
Yeah.
And it feels a lot better than chemo meds, I think, most of the time. So why not? Yeah. So anything else on this microdosing cannabis deal?
No, I find it really interesting, and just excited to see stuff like this, because this has really been also my experience too. Very, very small doses have just been really helpful for different pain things and just kind of getting in touch with my body in a different way. There was a time I remember I didn't want to take the pain medications after I got my wisdom teeth pulled, and I made a bunch of butter. And I noticed, like, thinking like, oh, it will help my pain. It actually amplified my pain. I became too aware of my teeth being out, and it became more painful than actually numbing the pain. And so, I don't know. Again, cannabis affects everybody differently. It seems to heighten my body sensations at times. And this is back when I really wasn't thinking about dosing and stuff. I was just, I'll just take this. And I just remember sitting there being like, my mouth hurts so bad. And wow, they just pulled these things out of my my mouth. And yeah, so.
I wanted to mention, I have a friend with she had a ferocious spinal fracture, broke her back and multiple vertebrae. And they all had to be removed, and she's on tons of nerve pain meds and for years, and eventually got on some sort of medical cannabis program in New York City and was able to get her pain totally under control with a mix of CBD and THC. So she's no longer using opiates whatsoever. She had a whole titanium thing implanted, and is just, functional. Like it's certainly not pain-free when you have that bad of an injury. It's,
Right. It's always kind of
pain-free is kind of a pipe dream. But, just the fact that non-microdoses can help someone with that severe of an injury, like I think speaks volumes to like the potential for, reducing the use of like more dangerous meds.
Yeah. I think this is interesting from this article too, that it's just low dose THC versus like incorporating CBD. Because when we think about pain management and whatnot, we really think about CBD. So it is really interesting here to see that this low dose of THC is correlating to, a difference in pain tolerance and chronic pain.
I'm so psyched that Israel's doing all this work, like because it's not really possible to do it here skillfully.
I think they're ahead
just amazing.
of us in this type of research.
Totally. Like I think Israeli researchers found THC. I don't remember the guy's name. Like they discovered THC. Like there's just so many interesting things happening in Israel around this. So I'm just excited to see where it goes, and thankful for them really doing all this crazy hard work.
Yeah.
Cool. So let's jump to psychedelics and somatic psychology. I don't know. Like, I have the feeling that we haven't really featured your knowledge on this very much, Kyle. And it's kind of a big deal. Like you did a graduate degree on this somatic psych stuff and essentially an undergrad in psychedelics, aka transpersonal psychology.
Yeah.
And so you've got a really interesting background and a lot to share. And I don't know that we really have been fair about it. So somatic psychology, it's an interesting thing. Like I like to say it's a totally different way to understand the body and the human being. And how do you like to frame it?
It's funny when I was looking at programs and I went to the colloquium just to check out the program. The advisor at the time was really trying to fight for an integration of somatic theory into the traditional counseling program. And her argument was, why do we even have to separate it? You have a body, you walk around. That's somatic. And so, it's kind of even just coming back to Newtonian Cartesian paradigm of separating both of them and thinking like psychology is just really focused on the mind. We have a body, we're here. And how does that play a role in our psychology and in our human experience as well? So when people ask me like, oh, what is somatics? Well, it comes from the Greek word soma, which just means body. So it's just a body-focused approach to therapy and mental health. And it's funny because somebody mentioned to us in an email about feeling like somatics doesn't really get approached much within the psychedelic field. And my response was, maybe you haven't been following our project that much, because that's my whole background and thinking about breath work and all this stuff, very somatically focused. But I think the reason why is because, we're usually interviewing people. And I think since we've been doing the Solidarity Friday episodes, we've been putting more of our opinions and work into the show. And so people are starting to learn maybe a little bit more about us in some capacity than versus just having a guest to interview and ask questions. And, sometimes like when we're interviewing, I'll relate back on some experiences just to, maybe help guide the conversation or ask a question. But, what really turned me on to the somatic approach was through breath work, but also I had an experience with physical therapy that really actually got me on the path to want to study somatic psychology even more, which was also influenced by my experience with breath work. So thinking about, my early years exploring psychedelics, I was so focused on the mind. The experience was outside of me. The knowledge and the wisdom was in the numinous. And that's where I was going to find all the answers and spend a lot of time there. And sometimes I still go back there and think like, that's where I feel home, is in more this ethereal realm, this thinking, cognitive realm, very analytical, always trying to problem solve, look at synchronicities, look at different patterns, try to put things into place. And I feel like, it was only getting me so far at times. And I could definitely get just in process loops and get so caught up in, every bit of information and just like feel so starry-eyed with everything coming in, be like, oh, the answer's here. And just wanting to get further outside of myself to try to wrap my mind around, some of these things I was really trying to explore. And it wasn't until I had like my first breathwork experience where it was such a somatic experience where I was feeling the experience in my body versus externalizing my experience outside of my body and viewing it more as this thing of novelty, of something I've never experienced before. Actually having that experience and feeling it within myself and being like, I have felt this before and it's inside of me. And that was just a very, very different approach to, I guess, working with the psyche and thinking about healing. And so I've always, I guess, approached healing from that external factor of I need somebody to heal me, or I need to find healing outside of myself. And I guess coming across breath work and having more of these body-oriented experiences and processing trauma through the body helped me, I guess, like recontextualize really what was going on and put it in a different perspective of going, oh, I can actually do this work inside of me without trying to search for it outside of myself. So that's what I guess like really kind of turned me on to that realm of somatics. And I don't know, I'm curious too, your experience with breathwork and if that kind of helped like shift things for you. I mean, the whole bodywork aspect.
It just reveals how much is not immediately available in the kind of day-to-day consciousness. There's so much happening and so much stored in our body that we just don't even really have a handle on, I think. Like somatic psychology is just like at the bleeding edge of this, like this whole polyvagal theory. Mm-hmm. Like there's so much happening around understanding how body and mind interact. Are body and mind separate? Kind of no. Like my favorite line, which I'm starting to feel like I'm cheating, but just say like mind is at the very least diffused throughout the body, at the very least, meaning that I think it's probably beyond the body. So, it's an interesting deal. Yeah. So there's just so many depths. There's so much happening, and the level of subtlety is really profound. Mm-hmm. Like the smallest thing. Like one of Lenny Gibson's lines when he was trying to train me for body work was his method of telling these long, convoluted stories. You're like, what are you doing? Why are we going here? But it's like telling me this long story about safe crackers, how they would actually like file down their fingerprints so they could be more sensitive for touch. It's like really, really just try your best to hone in when I'm doing body work on somebody else, like the smallest little quiver. Like it doesn't have to be a big thing. It's just like the smallest sensation could be a hint that that's the place that you need to work. It's just really fascinating. I really want to know more about this stuff. I'd love to take the Hakomi or somatic experiencing training just to like get a handle on what's happening in those worlds. Mm-hmm. Yeah. But realistically, it's not necessarily about the technique, right? It's about the human doing the work. Yeah. Like if somebody's an asshole and they're doing Hakomi, like I probably don't want to go to them. Like I would probably prefer to go to somebody who I'm getting along with and like. Yep. So there is that therapeutic alliance, and it's a big deal. Isn't that more of an indicator of success, more so than like anything else? Like how well you get along with that person or how that relationship?
Definitely. I mean, there's so many studies based on that. And I just remember, even in a lot of the textbooks and stuff and research, it was always kind of really focused on therapeutic alliance. And I remember Lenny always highlighting this one research. I forget who did it, but it was surveying college students, and I think that they had depression or anxiety. And one group went to, I think, their academic advisor, and the other group went to, somebody more clinical. And between the two groups, they both had very similar outcomes. The only difference was the people that went to the clinical group used more clinical jargon to describe their experience. So really just highlighting, I think healing happens in relationship. So I think finding somebody that you can feel comfortable with and you feel like you can develop a relationship with over time is probably the most important factor within healing and in therapy.
Yeah, absolutely. So psychedelics and breathwork seem to make the somatic material just a lot more available. It's a lot more immediate, bigger, like this idea of non-specific amplifier. I think it plays a key role here. And
right. Mm-hmm.
It's a hard thing to talk about because it's like a secret language. It's like a secret way of communicating that we don't really have access to normally. Like we're not trained. We're not given language instructions about the body. Maybe in yoga there is, or like some somatic traditions, which, there's some long lasting traditions out there like Rolfing, even Wilhelm Reich's work. Did Reich get some of the body work from elsewhere? Do you know? Like from earlier in European tradition?
I forget. But Reich is like the father of somatic psychology. But I forget where he learned the body work technique stuff from.
Right. Character vegeto analysis and this idea of
character armoring. So
character armor. Yeah. So like that's why people's shoulders come forward and are up, and like their back is just a rigid mess. Mm-hmm. And it's this idea that neurosis isn't solely a psychic phenomena, or like purely mental, I guess, and separate from body. It's like closely linked.
Yeah, I think Reich's phrasing, and I've heard Lenny say this and refer to Reich, was neurosis is represented throughout the entire organism. And so when he usually uses that phrase when describing body work, because it's like, oh, am I getting this right? Where should I do it? But thinking that the doorway into the neuroses is within the body, it doesn't really matter where you start sometimes, just as long as you start it, and it will start to express itself eventually. And I think that's why Reich did the things that he did with the breath work, with the the different movements and exercises. Like I think I'm a little bit more familiar with some of the bioenergetic stuff from Alexander Lowen, who was a student of Reich. But just thinking about like moving your arms back above your head, really opening up your chest, breathing into that space, letting it shake, working with that character armoring, you really start to notice what's going on in your body when you start to go into it. But, that's something that you've brought up, I guess, in a way in the past when you're talking about like the language of the body. How do you scale intuition? How do you teach intuition? Because that's what we're really trying to talk about here, is how do you help somebody develop a language around what their body is expressing, and how do you learn?
I think it's through experience, right? Like I forget who we were chatting with. I think it was a guy from Maya, but he's saying you can't scale intuition. And I'm like, I don't know that that's true. Like there's plenty of ways to teach people how to feel things.
Well, for example, like bodywork, the last bodywork module I went to, I think what Lenny really tries to do at times is really help people focus on the intuition versus the technique. In our Western mind, we're so focused on the technique that intuition and, this other way of approaching it kind of goes out the window, because we need to know if we're doing it right or wrong. Oh, I need to know this specific technique for this specific thing, versus really tapping into the participant and having more of a relational process with the participant, versus as a facilitator coming in and be like, okay, I'm going to do this technique to you because I know what I'm doing, versus, well, where is the client and how can you both develop, where this person is and how can you do the body work together? And I think it takes a lot of trust in yourself to start to believe in that, to believe in the process. And it is a very hard thing to teach people. How do you start to trust your own intuitions? How do you start to learn the language of the body to trust that? And I remember even just, sometimes when I ask people to check in with their body, they go, oh, I don't feel anything. Well, are you sure you don't feel anything? Do you feel any a burning sensation, a tingling sensation? Is there a sensation of dullness? Is any part of your body feel like it's expressing a color, a sound? So even just developing a language around sensation, like, oh, you're right. Yeah, there's kind of like a tingling feeling in my foot. Great. That's a really great place to start versus saying, oh, well, there's nothing, right? Or, oh, you know what? There's actually this like kind of, I don't know, nice feeling that's kind of bubbling up in my stomach. But maybe when I ask, what do you notice in your body? People go, nothing, because maybe they're thinking it's got to be excruciating pain to notice anything. Could just be subtle little energies or feelings.
So typically what I do when I'm laying down next to somebody in breath work, asking them to do some sort of body scan, it's like, typically, yeah, no, nothing's going on. Then I just wait and wait and wait and wait. And how about now? Are there any emotions? Are there any colors? Are you seeing anything? You know, just kind of like exploring the different kind of sensory motor, is that the right term? Pathways, like just different senses, different types of perceptions that you can have, and taking your time, and kind of your line about, can you be curious about it? Like, can you spend time just kind of scanning and being with your body? Sometimes that's enough to really make some big moves, right?
Totally. Yeah. And just starting to develop that language. And what is that language? Again, I think it's different for everybody else. And maybe that's why it's hard to teach some of this stuff, is like, how do you help somebody develop their own relationship with their emotional body? And this is something I've brought up when people have interviewed me for their podcasts and starting to talk about somatics. As a culture, we're so body oriented at times, right? We think about diet, exercise. Yoga has turned into more of an exercise than a lifestyle or a practice. You know, that's
a religious practice.
Yeah. And that's the generalization. I know people do try to embody that, but we're so focused, I think, more on the physical material body than the emotional body. And that's something that's really hard to tap into at times.
Yeah, I totally agree. Yeah. So from your perspective, so someone has like a clinical psychologist with training in how to do psychotherapy. They've got more of a CBT framework for working with clients, so cognitive behavioral therapy or CBCT or something. And how does that person interact differently than somebody with training in somatic psychology? Like, is it just a very different way of interacting with the person? Or, you know, this is a generalization, obviously, because who is purely a behaviorist?
Yeah, I think a lot of people...
You're still a human with a lived experience.
Yeah, I think a lot of people incorporate a lot of different stuff, and...
largely syncretic.
Yeah. And I think even when I think about some of those other techniques, there is mindfulness involved. And I mean, mindfulness could even be somewhat of a somatic process, right? I mean, just simple observation of your sensations, your body, you know, like I remember, I mean, some of the CBT and DBT stuff I did definitely included a lot of that at times, just trying to be aware of what's coming up. But I think the difference is being more interested in the body process than kind of taking this more cognitive approach of saying, like, the mind knows, let's start with the mind. Let's start with this top-up approach and start there. Somatic is really a bottom-up approach. How do we start with the body to help understand our experience versus let's start with the mind to try to understand our experience and to really control everything. You know, when I think of like CBT, I think about like, you know, trying to reframe things, some of the homework assignments that some people give out for that, you know, relabeling, reframing thoughts and behaviors and stuff like that. You know, how could you not take such a cognitive approach and just try not to set out with some of these goals, right? That we need to change this. What does it feel like to just maybe feel some of these things? Let's start with the body first. And so I think that would probably be the difference is, you know, just taking more of this bottom up approach than this top down approach.
Yeah, I can see that. It's,
But I don't know, like I've never really got formal training in CBT, and it's just a weird thing. Like every place I've worked at, they're like, oh, just do some like CBT techniques. And I'm like, oh, I guess I can learn this stuff on myself. And they, I don't know, it's just funny. Like every place I work, they're just like, oh, you should know what this is. And then I'm like, I don't think I've ever received any formal training. Like, I don't even know if I really received any formal training in grad school. I mean, we went over like what CBT was, but like I've never had any like formal training in it.
I remember, having some wildly aggressive projections and reactions to CBT. Just like, all right, so you're just going to treat humans like dogs now, rats in a cage? Like, are you kidding me? I used to freak out about it because I'm like so kind of gung-ho about Stan's work and this like humanistic, like transpersonal approach. And it was because I didn't really have a kind of total understanding on why, CBT is so popular because it's so easy to research. Like, it is one of the easiest things to do repeated, controlled trials with.
Totally. And like,
it gets results.
Yeah. And everywhere that like I use this was short-term treatment, hospital diversion. I'm only seeing people for like, 7 to 10 days. When I was working with college students, I would only see them really for a semester before we had to terminate. They could come back the next semester, but just thinking you have less than maybe 15 weeks, sometimes even like shorter than that, right? Somebody comes in at the mid or end of the semester just trying to find some solution to their problem, and it has to be kind of short term, and I think that's why. But I mean, it is helpful to learn how to reframe some of the things that you're thinking about, and I think being able to blend everything together is really helpful. But I think when you just try to think that you're going to solve your issues through a cognitive approach, is somewhat limited at times. And, I think sometimes too, again, I think it comes back to balance and trying to understand all of it and figure out what tools are helpful when, because there's definitely times when maybe somatic approaches really aren't, beneficial. And sometimes it might actually take a long time for somebody to get in touch with that. So you can't just go into a session being like, all right, I'm just going to do this. Like, I remember when I was working with my somatic therapist, she was showing me things just because, I was seeing her for grad school and she knew I was in my somatic program. So she wanted to also show me different techniques. But, she made a mention of, I probably wouldn't do this or provide these techniques to people at least 6 months, sometime a year in, especially if there's some like very significant trauma there. And so coming back to like Peter Levine's work of like titration, like how do you titrate the experience, and how do you just not think that, okay, like I'm a somatic practitioner, we're just going to work somatically? That actually may not be helpful. Like, you might help somebody like uncover something within their body, and that's totally outside their window of tolerance and can be very destabilizing within their nervous system. So, also be really cautious too. And you can't always take things through that approach. And I think that's the issue with technique, is sometimes you get trained in technique and you think this is how I need to work, when I view the technique as a tool, and when is that tool appropriate? And I think sometimes, you might get, like, as a client or somebody seeking this specific type of treatment, I was getting a little annoyed for myself because I was like, I have all this breathwork experience. I have all this like kind of somatic stuff. Like, just show me the ropes. I sought you out as a therapist because I want to learn this stuff. And she took a very titrated approach to it. And I'm also very thankful she did do that, because I think if she just, there were some days I'd walk out of there, I had to walk around the block a few times, grab lunch, because some of the internal states that I accessed really, really opened me up and were very, very psychedelic, and I had to get grounded. So, and I'm somebody that I do a lot of this work on my own to begin with. I have my at-home somatic practice, going in my body, doing a lot of like kind of trauma release stuff. But, also amplifying it in the presence of somebody and doing other work where that relationship is involved, and it's very different, and it cracked me open in a different way. So I'm glad she took a softer approach at times, and I think that's really important.
Right. Because we've kind of fetishized this idea of just going super hard at times, and perhaps it's a Western thing, perhaps it's an American thing, but it's like more is better. And I've been in arguments with massage therapists I work with. Like, no, like, doesn't feel like it's working. So I got all pissed off, but they're the ones that studied this stuff. And there's actual data on like gentle is okay. Gentle is still helpful. Perhaps sometimes people need to get a kick in the ass, but maybe not always. And you've got to be careful. Yeah. It's like a case by case thing. Like, can this person handle it? Maybe. And maybe you do a small test, like a couple little checks before you go full on. And, if they don't pass, like, just go the easy way.
Well, even just thinking about like massage, for example, like my fascial release is so different than like just getting like a full like deep tissue massage, right? Like, because when you're working with the fascia, you're working with more of that emotional body, and that can be really intense. And so that's the experience that actually got me interested in this whole idea of working somatically. Now, obviously, the breath work was a huge part, but so if you've been following the show for a while, you probably already know about my near-death experience, but I have a huge scar on my stomach. So I have a lot of scar tissue, probably adhesions and stuff like that. And it's something I've always been trying to figure out, how do I work with this stuff? And I finally went to a naturopath. He's like, let's try physical therapy. I was like, you're the first person that's ever told me to do that. I didn't get physical therapy after my accident.
It's incredible that didn't happen. By the way,
I don't remember the doctors ever giving advice to do physical therapy or doing anything. So I went to this physical therapist, and she started to do all sorts of different techniques on my abdomen. And she was blown away. She's like, wait, you've never gotten any sort of body work done? You just let this kind of scar tissue sit for this long? It's like, nobody told me. Like, they got me out of the hospital. I had a follow-up. I don't remember them ever telling me about physical therapy or anything like that. And I asked my parents too, and they said they don't remember, getting those orders to, get your son in physical therapy so he could develop his abdominal muscles again. I don't remember any of that. It's like I had to try to figure out on my own. So this physical therapist was already blown away that I didn't do any sort of work on my scar tissue. And she was doing some myofascial release on this tissue, and I could feel it pull. And I was just so amazed, because I would always kind of do like this deep tissue massage at times, like when it was feeling tight. And when she did this very subtle pulling on that fascia, it was just something totally different. So I started breathing pretty heavily as she was going through this stuff. And I was transported back like a vision, and somatically, I saw myself back on the stretcher being rolled to the ER. And I just remember seeing the lights pass over my head. And so I started breathing heavily into where she was pulling stuff on. And, I was processing it a little bit. I started like tearing up and letting go of stuff. And I looked at her and I said, is this normal? And to start, I asked her this question because I just wanted to see what she said. I knew it was normal because of all my breathwork training and the body work, that this is totally normal. So I asked her, I was like, is this normal for people to have a big emotional response while doing physical therapy? And she's like, yeah, sometimes people have it. And I said, how do you hold space for this? And she's like, I don't know. We're not really trained to really do that, so we just kind of like let it unfold. And at that moment, I said, wow, how powerful could this be if this person knew these techniques to be able to release that trauma, but also had the, the capability and the capacity to hold emotional space to let that healing happen. Because there was a bigger process that wanted to unfold that day that I held back. I was in this physical therapy office. There's people outside. I mean, we were in a private room, but if I went into my typical breathwork stuff of like really, letting my body express and cry, because that's what it wanted to do. But I was like, I might freak this physical therapist out. She barely knows me. Like, she kind of knows a little bit about my background, but like there was some deep, deep grief that wanted to be processed there that I held back. And so that was the moment that I said, I need to learn how to how powerful could this be for body workers and people that are holding space for people doing this really deep work? How could they also get some sort of training in the emotional component? I mean, what type of healing could really then resolve if we had these spaces?
Were you able to work on that afterwards? That grief or trauma coming out?
Not with her, and I
mean, for you, like personally, after
sometimes.
Or did it take a while?
I think my recent experience at Soltara was one of the. I mean, obviously, like in breath work and stuff like that, but I think the deepest that I went into was probably at Soltara back in January, processing some of that stuff, that deeper stuff.
Yeah, that makes sense.
Yeah,
it's interesting, right? Like, we've got a long way to go. And I think this indicates, again, this idea that science is a series of provisional truths. It's like, yes, for sure, physical therapists are using the best and most recent science available to them, but it's still in this kind of Cartesian Newtonian paradigm where it's just muscles.
And just the body. Yeah,
like,
we're just working on the body versus, I think...
right, it's just a mechanical, hydraulic thing.
Yeah, how could we have a more holistic practice where you get trained in body work, but also some sort of counseling? And what would a new field look like if we had like these new professions that could possibly come out of all this science that we know about the body, the mind, and I don't know. I always envisioned like some sort of new field that incorporated physical therapy, massage, counseling, and stuff like that to work specifically with people that have had traumas that maybe haven't processed. And that was definitely something that came through in that experience down at Soltara, was me working on a lot of this scar tissue and thinking like, wow, like I wonder how many other people struggle with this stuff and they don't even know that they struggle with the trauma of a really profound accident or surgery. I mean, even just the whole thing of surgery has kind of fucked with me over, especially right afterwards. I always thought, man, somebody cut me open. They were inside of me. Did they leave anything inside of me at time? Just all these weird things of feeling invaded and like your body not having a say in it because I was unconscious, And these are all the subtle things that could be there, right? The traumas are still there and things I don't really think about on a day-to-day basis, but sometimes they creep in.
Mm-hmm. Yeah, absolutely.
So how do we get in touch with it? And I think cognitively, you can get in touch with it a little bit. You can think about it intellectually, but what does it feel like when you actually feel into that and create the space to go into it and trust your body and really allow it? Because there's a lot of weird stuff that can happen. For example, like the other night, I woke up from a very interesting dream and I had like all this like kind of pain in my hip, like this hip kind of abdominal thing that I've constantly worked on. And I was like, I'm going to follow the process here from this dream. And I let my body just shake it out. And that might be a really scary thing. Somebody just wakes up in the middle of the night and all of a sudden, this dream has instigated this more somatic process. They're like, what the hell's going on? But it felt really weird in a sense of like, this is like what my body's trying to process from the dream world into my body. And I'm just going to sit here and let it shake out in the middle of the night. This is what my body wants to do. And I don't know, it felt really good. It felt like I got rid of something that I was holding on to.
Mm. Yeah. This is where it's like, okay, maybe there should be a series where we're able to like, I forget if it's UDV or Santa Daime, they're doing ayahuasca like every other week, largely. And like, is that the right regular pace for that kind of a thing in a group setting at a lower dose? Perhaps.
Yeah.
Like their results in terms of like wellness and criminality and personality issues is speaks for itself. Like they've got a lot of success there. So like, how do we hold this? Because we're telling folks to pretty much not use psychedelics too often, but perhaps it's because they're using it in an ungrounded context without much of a container. Mm-hmm. And it gets really expansive and confusing. But if you're in this group and the group has rules and practices and constraints, you've got relationships keeping you in check, like perhaps then it's okay every other week at a moderate to low dose. I don't want to say it's okay to go for the gold and see God every other week, but perhaps there's something there, and perhaps it could help sort out these kind of stored traumas. Mm-hmm. But it's we're working on the basic questions currently, mm-hmm. and that's a more advanced question, I think.
Yeah, totally.
Yeah, and science has to be incremental. That's the only way science really works. It would be nice if we could somehow figure out how to have a more holistic science, a more, non-Newtonian science. Like Newtonian science is excellent. It's done a lot, but it's also a little pernicious, as Daniel Robinson says, when unchecked, because it's not the whole thing. And it's largely just studying abstractions that don't really exist on their own anyway. I would love to, if anybody has suggestions on how to solve this, please let us know. Lenny gave me some substantial reading to do last night. So just to try to like get a handle on it. And, hopefully we'll figure it out. Listening to a talk by Julie Holland recently regarding SSRIs. And there was this Princeton study where they had 3 groups, patients with SSRIs only, SSRIs plus exercise, and then exercise only. And the group that was prescribed SSRIs and exercise fared worst out of all 3 groups, which is a really weird deal.
I wonder what's going on there. That's interesting.
But exercise almost as good as SSRIs, but it's just really hard to convince people to do that. Like perhaps there's some sort of like endorphin blocking or endocannabinoid interruption, like runner's high interruption with the SSRIs, perhaps. But that's purely speculation and purely neuroscience focused. So perhaps that's not a reasonable answer. But exercise and eating well and getting outside in nature, like if you can pull those 3 things off, you're way ahead of the pack. I know it seems illogical to a lot of people, but we're living really abstracted from how we were evolved to exist. Yeah. All right. I feel like I'm on a tirade now.
It's interesting, right? And I just wonder how psychedelics are going to play a role in moving psychology forward and psychiatry forward a little bit. And I mean, I just think about Groff's work with breath work and, some of the somatic stuff. And it's like, I haven't really chatted with the folks really over at Innate Path, but, I'm excited that they use a lot of somatic interventions there. And when thinking about non-specific amplifiers of mental or psychic processes with psychedelics, I think having somatic approaches is going to be crucial for a lot of this stuff. How do you process all this deep stuff, all these weird feelings that come up, all these psychosomatic things that come up in psychedelic experiences? I guess it's one thing to be really cognitive about it, but, what does it feel like to maybe encourage somebody to process it differently? I don't know. It'll be interesting to see how that evolves over time. I mean, it's just been interesting to see, I guess, like some of my experiences over the years from like early on to now maybe having more tools in the toolkit and just seeing how it's really changed over the years and just being able to like hopefully like, regain control over things when things feel really overwhelming. It's like, oh yeah, I have my breath. I'm able to do like a little bit of body work if I'm starting to feel a little odd or like some tensions are coming up here and there. It's...
Yeah. So I guess long and short, there's a lot more we need to learn about somatic psychology. Psychology in general, like should include the body. It should include extraordinary experiences a la William James and beyond. Like the scope of psychology needs to be broadened, and hopefully that bleeds out into other care providers like physical therapists, as you mentioned, and others that could have a really big impact on humans' lives.
Totally.
Yeah. Cool. So we're at an hour 8. Anything you want to throw out before we wrap here?
No, I think we're good. I know that you have to get going pretty soon too, so it doesn't make sense to get in any other tangents.
Cool.
Yeah.
All right, Kyle. Well, it's been fun. I guess before we go, we'll just remind everybody again of Navigating Psychedelics for Clinicians and Therapists starting September 17. It's now CE approved for a number of professions through the Spiritual Competency Resource Center. I think we've got the APA credits through them in the state of California. We've got nurses covered, and I think therapists of various kinds too. No MEDs yet.
Yeah, I was going to say, just make sure to double check with everything. So you go to our Navigating Psychedelics course on psychedeliceducationcenter.com. There's CE information at the bottom of that page. So you can just scroll all the way down. It's right above the pricing options there. And so, yeah, check that out. Make sure that you can get credit, maybe figure out if your board will approve it. So, yeah, I'm excited to be able to offer the CE credits finally.
Yeah, it feels amazing. We've had a number of students already work through the process with us. It's exciting. our current students even were able to kind of get it late stage, which is wonderful. And yeah, just excited to see what else we're able to bring. So if you want to learn more, psychedeliceducationcenter.com. Again, it starts September 17. It will sell out. And this is the cheapest it will ever be. So if you want to secure your spot, please do. And we'd love to have you. And yeah, I guess that's it.
All right.
So thank you, Kyle.
Thanks, Joe. Thanks, everybody. Enjoy the weekend.
All right. And signing off for Psychedelics today, Kyle and Joe. See you next time. Bye-bye.